So aggravation, this is basically permanent. Something that has increased. Remember we did the diagram about, we talked about these two natural sloping curves. If the two sloping curves come back at the same level at some point, then that's an exacerbation. If the two curves are different, then it's an aggravation, it's permanent. Under aggravation, workers' comp, that is then a separate rateable component. Now, in the 6th edition, we did a nice little addition for you in the musculoskeletal upper extremity chapter, and that is we created what was called I hurt in the workplace, where a person can come in and can have symptoms that you cannot find a diagnosis for. You can give that an impairment rating, which is musculoskeletal pain. Because, you know, I do believe that some of these patients do hurt and we can't find a reason for it. And their symptoms are related to their work activities. So you can do a rating for the I hurt in the workplace, which is, say, 2% of the upper limb. But the nice thing about that rating is it's a one-time, lifetime impairment rating. So should that person experience a new episode, new employer, they don't get it rated again. So it's a one-time, lifetime impairment rating, which, see, is just another reason why Colorado should go to the 6th edition. Apportionment methods. So if you're asked to apportion, there's several ways to do that. One is duration of exposure, one is dose of exposure, and probably the least effective is pain levels. So the first two are based sort of on causation. In other words, knowing the risk factors for the condition at one time and what they were when that person was employed at stage A with employer A, and what they are at B with employer B, and looking at the causational factors, duration of exposure, years of doing that, versus dose, which may be how many hours per day, you can go through the process. When not to. Only one probable cause and many possible causes. So we've talked about this before. If you only have one probable, more than 51%, okay, more likely than not, then you don't have anything to apportion. You can have 1,000 possibles, but only one probable, then that's the only one, there's nothing to apportion. If there's no evidence of pre-existing condition, you know, it's very nice if the person has a previous impairment evaluation for their arthritis in their ankle of 10%. Then you see them, you treat them, and you rate it now at 15%. Well, it makes it very easy because you can say, okay, his previous rating 5 years ago was 10%. His new rating at this point is 15%. Therefore, because the condition was exacerbated, in other words, permanently changed, no, aggravated. Don't switch those words around, okay? Or you can say permanently. I always like to add that in so there's no, you know, exacerbation temporary, and aggravation was a permanent change so that even the attorneys don't get confused. I just add the extra word in for them. Then you can rate the difference between those two. So you would say that the new injury resulted in a 5% impairment. However, that's legally inappropriate on Longshore Harbor. The last employer is 100% every time regardless. Now that's a great job. Work for one person, get an injury, you get 100% for your whole body. Well, let's say 100% for your shoulder. You go work for a new employer, you work there for 33 minutes, you file a claim for your right shoulder, guess what? You get 100% impairment for that shoulder. You work for a third employer, you're on the helicopter flying out to the pad, it hits a little turbulence, that seatbelt hurts your shoulder. Third one,